In this video, I will be demonstrating how to perform a manual muscle test on the trapezius, which includes the upper, middle, and lower. I will be testing the upper traps first, which originate at the external occipital protuberance and inserts on the lateral 1/3 of the clavicle in a acromion process. Your patient should be sitting up straight. Instruct them to put their ear to the shoulder, raising their acromion, and then there will be pressure on the shoulder in the direction of depression and pressure on the side of their head in the direction of flexion anterior laterally. Make sure your hands are a little more posterior than lateral. Also, be sure to instruct them to keep their head straight, then tilting it to the same side. Some compensation you may see is that the patient may start to excessively rotate their head in order to raise the acromion, using not only other muscles but mainly the sternocleidomastoid, which would not really be a true manual muscle test for the upper traps. Next up is the middle traps, which originate on the spinous process of C7 and T1 to T5. It inserts on the acromion process and superlateral border of the spine of the scapula. To test the middle traps, you want them prone, and then you're going to raise their arm to 90 degrees, then externally rotate the shoulder to really isolate the middle traps. Then apply a downward pressure on the forearm. And I would grade this a 5 out of 5. Then I would go ahead and test bilaterally, once again raising the arm and externally rotating the shoulder to really isolate the middle traps. And then have her go through the motion. And I would also grade this a 5 out of 5. Some compensation you may see is that the patient may even start to laterally flex their neck a little bit in order to really raise their shoulder up. So make sure you instruct them to just use their arm and keep an eye on that. Finally, we have the lower traps, which originate on the spinous process and supraspinal ligaments of T8 to T12 and inserts on the middle portion of the spine of the scapula. You're going to want your patient lying prone, and they're going to raise their arm at a diagonal and once again externally rotating the shoulder in order to really isolate the lower traps. Have them raise their arm and then apply a downward pressure on the forearm. And I would grade this a 5 out of 5. Then I would go ahead and test bilaterally, once again raising the arm in a diagonal and externally rotating the shoulder. And then some compensation may be similar to middle traps with the lateral flexion of the neck in order to raise the arm.